but I'm also here really to make an important announcement about how we're making it easier for Victorians to buy their own homes. But of course, firstly to the numbers. There were 1,838 new cases yesterday, all locally acquired. We currently have 16,823 active cases. Sadly, 5 people have lost their lives with COVID-19. A man in his 80s from Brimbank, a woman in her 80s from Whittlesea, a woman in her 70s from Greater Shepparton, a woman in her 70s from Knox, and a man in his 70s from Moreland. And of course, we pass on our deepest condolences to their families and friends at what must be a very difficult time. 620 people are currently in hospital with COVID-19, 114 are in ICU, and 76 are on a ventilator. Of the people in hospital yesterday, 66% were unvaccinated, 26% were partially vaccinated, and 8% were fully vaccinated. On tests and vaccines, we have processed 77,554 tests yesterday. That's the 3rd record testing day in a row, and I want to thank each and every Victorian who came forward to get tested. Your efforts in making this contribution to giving our health professionals and also those who are doing our track, trace and isolate work, you've made an enormous contribution. So coming forward to get tested, even if you have the most slightest of symptoms, is a vitally important part of our armoury to get on top of the spread of this virus. We've got 36,600 vaccines which were administered at our state hubs yesterday, and many thousands were administered by GPs and pharmacies as well. 85% of the over 16 population has now received a first dose of the COVID-19 vaccine. An outstanding effort, and you can see that our vaccination efforts are now starting to gain quite considerable momentum. And of course, there's 56% of the population, of the relevant population, have received a second dose. Now, in the next 7 days in our clinics, we've got more than 26,000 first dose Pfizer appointments that are available, more than 5,500 AstraZeneca first doses available, and more than 21,000 first dose Moderna appointments are available. So there's plenty of vaccine out there for you. Please come forward. It is a great contribution that you can make for your community. You can do it for yourself and your health. We know that getting vaccinated is the greatest indicator that can assure the community, can assure yourself, can assure your family of the safety that we all are seeking through this effort. So we're now at a point where vaccine supply is less of an issue, and it's never been more easy to come forward. So please come forward and get your first shot. You'll be doing a great service to your state, to your community, to your family. So I'd like to take this opportunity really to talk about an important initiative that the Victorian Government is putting in place. We've all come to appreciate that the safety and the security of a home is a vitally important part of the level of well-being that people have in the current environment. And of course, it's become increasingly difficult. As a Treasurer, I could assure you that as interest rates are and remain low, asset prices do tend to accumulate and increase. And what this means is for those people who've been denied the opportunity to get into home ownership, then that goal becomes less and less obtainable. So today, the state government is going to put in place an initiative that'll give hope, that'll change lives, and it'll set a new direction for thousands of Victorians. The Home Buyers Fund, the Victorian Home Buyers Fund, which is a critical part of our efforts to get Victorians into home ownership. You know, of course, that we've already taken some considerable efforts along the way, whether it's our reductions in terms of stamp duty costs for first homeowners, first home buyer grants, or whether it's essentially our continuing efforts to invest in public and social housing. Well, this is a new and very substantial initiative. Home is at the centre of our lives, particularly at the moment in the middle of a pandemic. That's never been more true. So home ownership, it's a dream that the government wants everyone to be able to fulfil. That's why I'm announcing today that we will start a $500 million Victorian Homebuyer Fund, which is expected to help more than 3,000 Victorians become homeowners. They'll be able to buy homes with the support of the Victorian Government, which will be an equity partner in the purchase. They will only need 5% deposit to buy property under the arrangements of the scheme, with the Victorian Government, of course, kicking in up to 25% of the asset value. This will mean lenders' mortgage insurance and lower, that means no lenders' mortgage insurance, and it'll mean lower loan repayments. This might sound familiar because the government has piloted this through a $50 million Homes Vic Shared Equity Initiative, which has already piloted this program. We've refined it, we've expanded it, and we've enhanced the way it operates. But that scheme in itself managed to get something like 335 Victorians into their home, into a home. So the Victorian Homeowner Fund is an expanded version of that pilot, because we expect to get a lot more people interested, because we're going to take the burden of the capital outlay that will be required into this effort. So instead of the $50 million for the pilot scheme, it will be $500 million, of course, behind this scheme. And every time a home buyer pays back to the Victorian Government our share of the equity, so as you appreciate, at the point that either they choose to buy out the state's equity or at the point when they sell the property, the state will, of course, get its equity share returned to it. We will put that money back into the fund. So this will become a self-sustaining and, in all likelihood, given the continuing and historical appreciation in value of assets over time, that fund will grow. So we know, of course, that property is getting more expensive, and it's a source of concern and often, quite frankly, desperation for some people who feel that their dream is being denied them, that they can't get into home ownership. And we see it particularly for those who are young, who are starting out in life and looking to find a home for a family that they're making. So the state is, has formed the view that we have to be an active participant in this process. But we also know that these people would be able to service mortgages. This won't be a process where simply we will provide equity regardless of capacity. You'll have to demonstrate that you can put together a deposit. We will have financial partners, banks, who will be assessing your credit worthiness and your capacity to meet the payments, albeit that they will be substantially lower because the state is taking an equity share in these arrangements. But it is vitally important, I think, that we constantly challenge ourselves to find ways to help those who are not in home ownership into home ownership. So that's why we're stepping in, and we're going to lend a helping hand. We're making the criteria easier for the bigger fund, meaning more Victorians will be able to get involved in home ownership. So for Aboriginal and Torres Strait Islanders home buyers, we're offering deposits as low as 3.5% and a larger contribution from the government. We're also proud today to be launching this project, which represents the values of opportunity and a fair go for those Victorians who have felt, to some extent, left behind in terms of the property market. It is something that personally I'm very proud of. I know that my Cabinet colleagues have been working assiduously on this project for quite some time, And I hope that Victorians recognise that this is a very substantial step towards assisting those people who've seen the dream of home ownership has been denied them, a dream that this government is committed to ensuring that they can realise, should it be, part of their life plan. Thanks, and I'll now hand over to Brett.
Thanks, Treasurer. So just to the spread of cases for today. Yesterday in the northern suburbs we saw 631 cases, which was 35% of our total. The northern suburbs continue to have the largest number of cases, with more than 7,100 active cases, or 42% of our total caseload. In the west we saw 553 new cases, which was 30% of total new cases. In the southeast, which has been growing, there were 424 new cases, which is now 23% of all new cases. And in the east, there were 107 new cases. For regional Victoria, there were 113 new cases, which is 6% of all new cases. That's about steady. In terms of some of the larger regional numbers, yesterday there were 18 new cases in Greater Geelong, with the majority linked to existing cases or exposure sites. 11 new cases in Baw, all linked to each other or known cases. 10 new cases in Ballarat, all in known contacts. 7 new cases in Mildura. And there we've deployed a rapid response team, testing team, which did more than 100 tests yesterday. We've also sent up our laboratory van to assist with the rapid turnaround of tests. And the van can process up to 100 tests a day and give results within an hour. And finally, 13 new cases in Greater Shepparton, 6 linked to existing cases and 7 still under investigation, and 7 new cases in Moorabool, 3 linked to known cases and 4 under investigation. Obviously, Moorabool and Shep both under lockdown and need a decision today. I'll be going to the data there with respect to the cases under investigation, and in the context of exactly who those cases are, how much time spent in the community, and reflecting on the pretty good vaccination rates in Moorabool and Shep in particular. As the Treasurer said, getting vaccinated wherever you are in Victoria remains really critical. Goulburn Valley, there were 6,000 doses, and for La Trobe, 5,000 doses of Moderna supply sent this week, and we've administered almost 1,000 doses between them in just a few days. Today we'll distribute 2,000 doses to the remaining regional local public health units, so we can have Moderna walk up across the state. Some other changes: the border bubble. I'm pleased to announce that from midnight tonight we'll reintroduce some local government areas into that cross-border community area. That includes Benalla, Greater Bendigo, Bloke, Loddon and Yarriambiack. And on the New South Wales side, the local government areas of Hay, Edward River, Lockhart, Murrumbidgee and the city of Wagga Wagga. This means that people who live within the bubble, including now those areas, can enter and leave without a permit so long as they've stayed within that bubble area in the past 14 days. One small change to outdoor mask use, small but important I think. At midnight tonight, the directions will change to allow the removal of masks out we'll speak to this in a minute. We've certainly seen in countries such as England or the UK where schools reopened without strong mask use from the get-go, or indeed supported by all of those other layered mitigations, such as good ventilation, there was an estimated 8% of students absent from school in those early weeks with suspected or confirmed COVID or as close contacts. So we really want to have these measures in place early on to keep kids in school and to make sure that they're safe in the school environment, as safe as possible. In many states in America, school mask mandates have been put in place and they've helped to reduce transmission. It really has been shown that where there are multiple layers of risk mitigation within schools, that you can keep a cap on transmission and have kids return safely to that environment. So on that note, I'd like to invite Adjunct Professor Jane Munro to speak further on the issue. She's a paediatrician at the Royal Children's Hospital and recently a Senior Medical Advisor to the department. Thanks, Jane.
Thank you, Professor Sutton. I would like to begin by acknowledging the traditional custodians on the land of which we're all meeting today and pay my respect to their elders past, present and emerging. My name's Jane Munro and I'm a paediatrician at the Royal Children's Hospital and a Senior Medical Advisor, just recently, at the Department of Health. I'm actually a paediatric rheumatologist specifically. I've worked at the Children's Hospital here for over 20 years. I'm also a mum to 3 awesome kids, and so like many Victorian parents, I too have lived through the long ups and downs of remote learning these past 2 years, and I am ready and raring to go to get my kids back at school in the coming weeks. This decision today for grade 3s to year 6s to wear masks at school is a good one. It is backed by good science, it is simple, it is safe. There are no health risks for a child wearing a mask. It is easy to do and it is also common sense. In the next month, over 1 million Victorian children are going to return to 2,276 schools. And I'm told that's over 30,000 classrooms, so indoor settings. We all need to work together as a community to make that happen. I feel really strongly about that. We need to get our kids back to school and then to keep them at school. Last week, my colleagues recommended, so the colleagues at the Children's Hospital in Murdoch, Children's Research Institute, recommended about going back to school with the 3 Vs: vaccinate, ventilate, and vital COVID safe steps. Masking is one of these vital safe steps. At the Children's Hospital and Murdoch, we've developed a range of resources to help kids and their families understand what's going on with COVID, how to wear masks, and about returning to school. And if you keep checking the Children's Hospital website, you'll see these evolve and roll out over the coming 2 weeks. We're going to have kids' health fact sheets, videos, and next Thursday at 10 o'clock with several of our experts we'll have a Facebook Live, which is very popular with Victorian and parents beyond actually, session with some of our experts about returning to school and preparing for returning to school. At the kids, we've actually already recognised the importance of mask wearing for children in reducing transmission of COVID. So we've already rolled out a campaign on the campus to encourage mask wearing by younger kids. I'm also very comfortable that there are options here in this policy decision for children who have issues with mask wearing. And so I want to reassure Victorian parents not to worry. Mask wearing for kids from year 3 to year 6 is mostly just not a big deal. Parents don't need to be concerned. Kids are great, they adapt, they are resilient, and we can easily show them the way about how to wear a mask. Now, not all of them are going to get it right all the time, and I was actually going to point out in the journalists in the room, maybe some of them weren't wearing it, but you're actually doing a really good job, so I can't do that. But we all know the chin wearers and the nose danglers, and kids are actually really savvy. And as parents, I'd ask you to think back yourself about how your kids learnt how to wear a hat in prep, with a no hat, no play policy, or wear a seatbelt, or a range of other things that we teach children how to do that is good for them, but they aren't so keen on at the start. Some people might be still a little bit confused about why we need to do this. And it's because we want to get kids back to school and then keep them there. Professor Sutton mentioned about that 8% of kids in the UK that got COVID within the first few weeks and had to be absent. And that's really important here in Victoria because there is a lot of COVID around at the moment. So also, unlike for primary school kids, unlike teenagers, there isn't a vaccine available for them yet. And also, if you know kids, they move around a lot in classrooms in primary school. And they also tend to sneeze, snot on each other and even lick each other sometimes. And that's pretty gross, but it's reality. So trying to use steps to stop aerosol spread is really important. Also introducing some behaviour changes like physical distancing is really important and a good idea. And I want to emphasise that it's for now, it's not for forever. But it is going to help get our kids back to school and hopefully stay there. And I just have to pause to do a massive thank you to our phenomenal teachers and school staff in Victoria for all the work that you do. There's a lot of nodding here across probably many parents in the crowd of journalists. Thank you. We really need to have that good, deep understanding for all of us that COVID is an aerosol virus. We need to focus and understand about safe air in schools. That's really important. So wearing masks indoors at school protects kids from infection and it reduces the risk. It doesn't get rid of it, but it reduces it. And all those little things we do, when Professor Sutton says mitigations, that's what we're talking about. We need to do all the things that are safe and reasonable to reduce the risk of kids catching COVID and spreading COVID. So in terms of the two other V's, ventilation, improving ventilation is really important, and it is actually happening across all Victorian schools right now, and I'm absolutely stoked about this and the program that Victoria is rolling out. Vaccination. Victorian teenagers, look at you go. Look at you go, over 60% in 3.5 weeks for our first dose. That is absolutely brilliant. Total legends. Well done. And well done to the parents and carers for making that happen too. As a paediatrician, I've always known parents will do anything to help protect their kids. So now my other big message, if you're a parent and you have children returning to school in the coming weeks, please, this weekend, go and get vaccinated. It is really important that we ring fence those kids with the adults in their lives being vaccinated. If you have Year 12 students coming up, please go and get them vaccinated, help them get vaccinated. Many of them are already. But with 1 million children going back to school, COVID is going to spread and many things are being done to reduce that risk. But fortunately for children, although COVID is generally mild, we don't want lots of infections because that is going to have a huge impact. And if children get it, they will take it home. And when they do, the adults in their lives, the parents, the aunties, the uncles and the grandparents, they will get sick and they will possibly get very sick from COVID if they're not vaccinated. That is not okay. It's not okay for those children. It's not okay for those adults. Please get vaccinated. At every talk I've given since 2016, no matter what setting or what topic, I mention doctors' health and healthcare worker wellbeing. And this is perhaps the most relevant setting for this on this platform and here, particularly in the middle of COVID, for all the work that healthcare workers have done in this pandemic. Thank you to my healthcare worker colleagues for everything that you do. It's hard right now. Let's care for each other. In press conference after press conference in Victoria, Victorians have heard about the stress and strain on our healthcare system. Delta is really biting now, and our healthcare workers are tired and we are stretched. But we want you to know that we are here for you, Victorians, and that we are still here if you need us. So please access healthcare if you need it. Please go and get vaccinated. Help others to get vaccinated. There is plenty of vaccine around. You heard from the Treasurer. Go and help someone access a vaccination today. It's a reason to leave your home and it will make a positive difference to your community. So for kids, vaccinate, ventilate and vital COVID safe steps. And for kids of Victoria, it's really exciting. You're getting back to school soon and we're going to help you do that safely. To the adults, let's make sure we work together as a community to help do it. I'll hand back to the Treasurer.
Well, thanks very much, Jane, and it really does give us a great insight into the challenges that Victorians will face as we move into a stage of progressive and measured opening up. But it's great to get the wise insights of professionals in this area that let us know that whilst this will be challenging, you can all make your contribution to help our health professionals deal with this matter and also to make it easier as kids return to school. So we're open, all of us, to any questions it might have.
Treasurer, Victoria Police have today launched an investigation into footage of the Premier not wearing a mask. What do you make of that?
I make of it that Victoria Police have launched an investigation. Might I say that the Premier's been pretty diligent in terms of his behaviour, and I think there's. Had a brief look at the footage. It looks like he's been approaching a camera for the purposes of doing a piece to camera. Of course, you're allowed not to wear your mask, so we'll leave it at that and let the police do their work.
Will he be fined $200?
I think that will entirely depend upon the police investigating the matter.
As our health system, you should be able to answer this as a treasurer for a long time. Has our health system been underfunded for many years, which is why the system is now facing an unprecedented crisis?
Look, I think what's happening is we're in the middle of a worldwide pandemic, and we're putting every piece of effort into making sure that we are adequately resourcing that fight. There is no sensible amount of funding that you can put in a non-pandemic environment that would enable you to have the sort of capacity that you need in terms of an effective public health response to deal with the challenges that we're confronting. So it does mean that we have to substantially augment what would normally be the case, and we put in literally billions of dollars of extra effort into our public health response. But you're also seeing that the effort that we're putting into supporting businesses in the community is not something that would normally happen. It's an investment not only in keeping the community safe, it's an investment in making sure that our economy and our community are adequately protected going forward. So yes, we are seeing a very substantial spike in government investment in public health. But I would dispute an argument that would say we came from a base that necessitated this level of investment. In a pandemic environment, making these investments is vitally important, but they're unprecedented.
But I mean, people from the AMA down say that the Victorian hospital system and other hospital systems around the country have been underinvested for a long time. The Labor Party's been in government for 18 of the last 22 years. Has there been enough done to keep the hospital system, I guess, in line with population growth?
Well, I think that's a debate that, of course, we can have in the cold light of day about what constitutes an appropriate level of resourcing going forward. But I also think there is no doubt that we've had a very substantial public health response that has demonstrated the skills and the capacity of our public health team. Will this mean that in terms of public health going forward, the government will need to put in more resources? Almost certainly, I think. There are learnings that we will have as a consequence of this event, no doubt about it. But I think the bottom line here is you could never have resourced in a pre-pandemic environment to the level of resource that we require now. Would there be a level of resourcing that will be necessary going forward to assure that we can step up in a much more managed and measured way? Well, that's a debate we can have at an appropriate time.
Can I ask Brett some questions about the health capacity?
We have just seen the ADF deployed to support paramedics and ambulance services, so doesn't that indicate that there's not enough resourcing to deal with this crisis?
Oh, well, it does indicate that we have a pandemic event where there is an enormous strain upon our health and emergency services. And I don't think this has come as a surprise to anybody. We've been preparing for this for some time. And when you're in an event of this nature, the community needs to band together, and governments need to resource a response in order to facilitate our frontline workers so that they have the resourcing necessary. The fact that the Commonwealth are applying, I think it's some 10 drivers to assist with ambulance response, that's a gratifying thing, and it's something that we're thankful for. But quite frankly, if you've got a defence force and they've got a capacity to drive ambulances, it's probably the best use of their time and effort when the community needs it. So I would simply say that that is a resource that's been made available, for which the state is greatly appreciative, but it shouldn't come as a surprise that we're banding together and effectively utilises resources that are available to us. It's simply a logistics act of common sense.
I must ask you you some questions on your announcement today before we go to Brett.
Sure.
Why is the state government sort of seeking to become a bank at this time when we've got a huge economic strain on our finances from the pandemic?
Because people will need assistance all the way through this pandemic and as the economy grows. And more importantly, we can't simply use the pandemic as an excuse for being a one-trick pony. There is a real issue that is impacting upon people's livelihoods and their well-being, and perhaps a pandemic demonstrates that more at this time than at many other times. That is, having a home, a place where you can find refuge and have comfort and shelter, I think is vitally important. A home to call your own. So from this government's point of view, we've been, over the last 5 or 6 years now, producing policies about giving people access to home ownership, should that be part of their plans. Certainly we are not becoming a banker, and I want to stress that point. We're taking an equity share. We are therefore, a bank doesn't take an equity share in your house. They give you a loan and they make sure that their loan is protected. So we'll be providing to people with an income of $120,000, and if you're a couple, $200,000. You'll be able to buy a property to the maximum value of about $950,000 in metropolitan Melbourne and Geelong, or $600,000 in regional Victoria, provided you can get the 5% loan, provided you can meet the loan criteria that our banking partners set, and as a consequence, the state will take a 25% interest, unless of course you're Aboriginal or Torres Strait Islander origin. It'll be 3.5% and $35,000. We take out our share of that equity at the point either of sale or at the point that the homeowner actually decides that they want the state to depart, so they buy us out in effect.
Will they have to pay stamp duty?
Yes, they'll have to pay stamp duty if they're required to pay stamp duty, of course. And of course we have rules around stamp duty not being applicable to first homeowners in certain circumstances. Of course they won't have to pay mortgage liability insurance.
Treasurer, won't this
Just a question.
Treasurer, won't this just keep pushing up house prices in what is already a hot market?
Well, no, I don't think it will. In fact, this is not something that will effectively augment the price. We're not putting more money into people's pockets. In effect, what we're doing is giving them the opportunity to participate in a competitive market. I might say we are seeing prudential rules starting to be tightened up for first homeowners. And if you want to argue that that is a good thing, I would argue that it is not. As a government, we are resolutely committed to the idea of giving people who want to get into home ownership, and this scheme is not exclusively for first homeowners, it's people who don't own a property, so it gives perhaps people who are looking to move back into home ownership, having been out of it for a while. But it's about making sure that we don't just simply see a distortion of the market that preferences investors. Otherwise we'll essentially get to a world where young people, our kids, people who've been out of the housing market for a variety of reasons, don't get the opportunity to compete. It could be argued that every measure that government puts in place in some way distorts the market. Governments intervene because in many cases the market itself is distorted, and what we're seeing in terms of the restrictions on people being able to access the home ownership market, being able to compete in a competitive process for home ownership, I would say is a distortion that we need to rectify.
Treasurer,
Tax is also having an impact on this because, say for instance, the windfall gains tax you're looking to introduce, that may increase the price of, say, apartments, which can be first homes for people that are in vulnerable situations or that sort of thing. Like, wouldn't the state look to decrease taxes first before coming up with a fund like this?
Well, in fact, the state has been decreasing taxes when it comes to first homeowners.
You introduce a windfall gains tax, though.
Well, it's about making the right choices about how we think the market should operate, and certainly from our perspective, windfall gains is as much about probity as it is about anything else. It's about making sure that we don't have a situation where there's an inappropriate level of reward for effectively speculating in property rezoning. So from a government point of view, we think this is both a modest and a measured intervention. We know that, of course, by making these changes, yes, there will be a very minor level of revenue come to the state, but if there are these massive wholesale rezoning uplifts, that's when the tax will have its most application. I dispute the idea and the argument that some in the property industry have been putting forward that this will effectively push up the price of housing, because essentially what they're saying, they should be able to make an inordinate profit on a rezoning decision that enables them to go about delivering housing stock, and that
Just
should
on the
not be
fund,
part of your business model.
Sorry, just on the fund, what risk does the state assume though with these people? Do you assume that everyone will pay back the money in time, or is there a risk that they may not?
Well, there's a normal assessment in terms of what constitutes bad loans, but they're relatively minor, and we're using the banks as partners to effectively assess the loan making arrangements. So we have banking partners, they apply their loan criteria, they have a considerable amount of skin in the game, as you'd appreciate.
But so does the state though, so the SRO doesn't get involved in that at all?
The SRO essentially, or the government through the Home Buyer Fund, will have oversight over it, but the criteria will be oversighted and managed by the banks, because the banks will be providing 70% thereabouts of the loan, the amount minus the deposit and minus the state's 25% of the equity. So our view is, if you look over the long flow of history, there are rare occasions where asset values on housing stock reduces. They do occur, but they're pretty rare. So provided you're in it for the long term, then the state is making a choice, and that choice is, we want to help people who otherwise cannot access the property market to be able to do so to acquire a home.
Treasurer, a 5% deposit obviously sounds quite attractive, but do you not foresee any issues with loan repayments further down the track, especially if interest rates were to rise?
Well, once again, this comes back to the loan criteria approach. What banks do when they provide a loan, and we will and do have quite a number of substantial banking partners, they assess your capacity to make repayments. They assess your credit history. They assess your income and therefore your capacity to make the repayment. All of those things will continue to apply. Nothing will change in that respect. What will change, however, is of course the level of repayment you'll be required to make, because you don't have to pay an amount as if you're servicing a loan to the state. The state will take its share of the asset and its appreciation over time. We're not going to put it, we're not in the business of property speculation for its own sake. We will then put that money back into the Home Buyer Fund so that future people seeking to get into home ownership will have the same opportunities and access that those who sold on their properties have had.
So you don't just foresee this creating massive debt, essentially?
Debt?
You don't foresee this just creating massive debt?
With regard to those who are making the repayments? No, because essentially we put a criteria that restricts the amount of property that you can buy into, $950,000 for a property in Melbourne and Geelong, and $600,000 for a property in regional Victoria. So we know around median price, a little bit more, but around that median price. So we're not talking about buying mansions, we're talking about people getting into a properly resourced and provisioned home. So the big question is, can people make those payments? Nothing changes in respect of that other than the level of repayments that they'll have to make. The banks will still assess them based on their capacity to make payments. And yes, there will be examples of people who get into loan distress. as there always has been, but they will be properly managed, and we've seen through schemes like this, whether they're in South Australia or West Australia, they're on much smaller levels of activity, but we've seen that the arrangements that they've put in place have not had greater levels of loan failure than essentially the normal bank loans have had. It's about making sure you get the criteria right for your borrowers.
Can I just ask some questions about the health system, if I can, please? Professor, we've seen in the UK they've opened up, they've passed their vaccination thresholds. They're still seeing about hundreds of people hospitalised every day. That's probably going to happen here next year as we open up. Is the system ready and prepared to do that?
I mean, I'm not the hospital system steward. From a public health perspective, I think the UK could have done some things a bit better than they have. They've got 35,000 cases a day, 160 odd deaths per day. That's probably there's probably a preventable element there if you can do it a bit smarter. So I think we've got opportunities to be stronger in terms of our school transmission. As I referenced, the UK didn't have mask mandates where they perhaps could have. They could have done better work in terms of ventilation within schools. So I think we can do better than that kind of scenario in the UK. And the UK is not performing well on a Western European kind of measure. So there are a number of countries that are doing much better with regard to that. Spain and Portugal, Italy, pretty low levels in terms of stresses on the hospital system. So we can aim for the highest vaccination coverage possible. And Portugal, with its 97% coverage with vaccines for eligible populations, is a fantastic threshold to aim for. Our childhood immunisation program gives us a lesson that people are ready and willing and understand the benefits of vaccination in Australia. So I'm fully expecting us to get above 90% vaccination coverage, and I think that makes a difference in terms of the stresses on the hospital system. And I think we're sensible and evidence-based around those other, minimally imposed public health measures, the behaviour changes that people need to go through, the QR check-ins, the social distancing that people will have, whether or not there are public health directions around it, but the spacing that people have as they're queuing up and as they're in indoor spaces in particular, and all of those other things that we know will make a difference in terms of testing, including rapid testing. Those things can make a big difference on the stresses in the hospital system, and I think we can do pretty well in that regard.
From a public health perspective, are you concerned about, I guess, the delays in the ambulance call-outs and ramping at hospitals and pressure on the hospital systems for not just people who have got COVID, but for people who have other illnesses that need acute treatment?
Of course, any stresses on the ambulance system or admissions to hospital or access to emergency departments is a concern, not just for those with COVID-19, but for everyone else who's trying to get routine care or emergency care. So, yeah, absolutely. I think it is, today's a record number, but it is important to reflect on the fact that our ICU admissions, for the number of active cases, it's 2/3 of 1%. That's a reflection of our very high first dose vaccination coverage, which protects you from severe illness. So having that high level of coverage just with that first vaccine is really important. We'll start to drive transmission down and get over that peak very soon with our second dose coverage coming up above 50-55% as well. So we can make a difference in that regard, and it's really important that we recognise the pressures on the hospital system and what vaccination will do in that regard, but that it's already doing in that respect. I think New South Wales, with its, with a similar number of active cases or cumulative cases of COVID, had more hospital admissions, more ICU admissions. So driving that first dose coverage that we've done in Victoria has been a really good thing.
Are you comfortable with the preparedness of the health system for this?
As I say, I'm not the hospital steward.
As a public health, chief health officer, were you prepared with this? I mean, when you're making your decisions, surely you look at hospital preparedness, and were you comfortable with where we were at?
No. So my role is to do the very best in driving down the COVID transmission in the community with the hospital system in mind. But the hospital system preparedness is really for our deputy secretaries and the commissioning and service improvement division in the department to manage. Of course, I want to minimise those impacts, but that's exactly what we're doing, and we're doing it to the utmost of our ability.
Professor, do you think that Daniel Andrews should have been wearing his mask while he was walking in that car park? Has he done the wrong thing?
I haven't seen the video, so I can't comment on that. As I say, as the Treasurer's made the point, the police will review it and they'll make an appropriate call. They know what the public health directions are in terms of what mask requirements are.
Professor, the Burnett modelling suggested we were going to peak towards the end of the month between 1,400 and 2,900. Is that still on track, or have we peaked earlier?
No, I think it's still on track. We'll check in again with the Burnett modelling with new data which has come through over the course of the last week or so. That'll obviously help to update that. We saw an increase a week ago that was a pretty significant jump, but it has started to flatten off. The 7-day average, I think, is in the 1400s for the last week. So we're not going up at the same rate as we were in the previous weeks. I think that's a good sign. I think we're heading to the peak, if today isn't the peak, and I don't think it is, but I think we're close. As I say, the specific numbers for today always a concern because it reflects, ongoing significant transmission and a number of positive cases in the community. But our numbers in ICU, numbers hospitalised, is not rising at the same rate, and that's a very good sign in terms of what vaccines are doing now.
Also on that modelling, the deaths were around the 2,000 mark sort of by the end of the year. It doesn't seem we're going to get anywhere close to that on current numbers. Is that a correct assumption?
I don't know. I mean, it is based on what we know about the severity of Delta infection and the numbers that we would see. We are not at the peak in terms of the numbers of people who will die, because there is a lag of 3 to 4 weeks from your peak in case numbers and then the peak hospitalised in ICU. We are working to minimise all of the impacts, including that tragic impact of people dying. But there will be a proportion of people who are as yet unvaccinated who remain vulnerable to dying. That's a reality. We've got high 90s, 95% coverage for some of those age groups, but there are still some people who will remain absolutely vulnerable, who remain unvaccinated. So we need to keep pressing on coverage across age groups.
And if we get to that 70% double dosed, but we're still seeing case numbers up around that 1,800, 2,000 mark, are you still comfortable that we can follow the roadmap?
Yeah, I think so. They are moderate changes at the 70% mark. We'll watch what happens over time with those numbers, and we'll watch what level we're at as we go into that threshold. But as we've referenced before, and as New South Wales has done in looking at Victoria's trajectory, we will see what happens as New South Wales opens up, as we've reflected on international experience. You can do it safely. We're doing it incrementally, and we're doing it with a relatively conservative approach. So I think that's on track for us.
Do CFA volunteers, do they count for the mandatory vaccination as essential workers?
I'm not sure, Rich. We can come back to you on that.
Yeah, if we can get some clarity on that.
In terms of schools, Professor, once they go back, how is the department going to manage contact tracing? We know that the system's changed, so people are getting text messages and sometimes exposure sites are going up a couple of days later. Will there be a kind of specialised team so that it's not complete mayhem at schools when one student gets it and schools are working out who needs to be off and on?
Yeah, absolutely. So there is a team to work on it, both focused within the Department of Health, but also Department of Education and Training have a team working closely together. They've obviously got an understanding of who's in the class and where and how to contact them. So those channels within DET will be the primary mechanism for identifying and following up with students. But the policy settings and the matrix for contact tracing really sits with the Department of Health, and we'll be able to focus our contact tracing responses on the basis of where kids are sitting, for older kids, whether they're vaccinated or unvaccinated, whether they're wearing masks or not wearing masks, and really that level of contact that they have face to face. We don't want any more disruption in schools than is absolutely necessary. We want them to continue with their learning. So there'll be cases in schools, there's no question about that, but it won't be a case of the entire school population being in quarantine for a 14-day period.
Are you relying on that process being 100% accurate? It's quite a complex process that schools will have to follow among their regular tasks of teaching and everything else?
Look, it's a relatively complex process because there are, genuine close contacts, and you need to make assessments for every child who becomes a positive case. But the procedures will have their, lead up time over coming weeks, and we haven't got all kids going back at the same time, in part so that we can refine these measures and make sure they're working appropriately.
Masks in schools for those younger kids, is that just in the classroom? What about at lunchtime, recess?
No, it's just indoors. So outdoors, we know the risk is less, and kids, I think likely wouldn't be wearing them running around anyway.
How concerned are you with compliance with this? How concerned are you with compliance with this, given we're talking about young children?
Oh, as Professor Munro said, kids are adaptable, and the international experience is that they just make this a normal part of their going to school. That's especially the case in California, where there are a bunch of mandates in place. But there are lots and lots of places internationally where kids have gone back, young kids have gone back wearing masks. As I say, some will struggle more than others, but many of them will have a bit of fun with it. There are pictures and faces that kids have on masks, and they will make it part and parcel of their daily learning, I expect.
Do you know if any cases have been linked to, any of today's cases, linked to the cancer ward at the Royal Children's Hospital?
Not that I'm aware of, but I don't know.
What is the status of those police officers in hospital from the protest?
Oh, look, we wouldn't give an individual update on someone's clinical state.
Are you able to confirm if it's one or two police officers?
I don't know, Simon. I can come back to you on that.
And could I maybe ask our colleague from the Royal Children's, are you able to speak to the situation in the cancer ward at all at the moment?
In general terms, if you know, yeah.
If you wouldn't mind. How, from speaking to your colleagues and what's going on in there, how is the situation being managed at the moment?
I think it's being managed really well. It's really tough. I think it's people hear about it, and it's a very heart-rending situation. But we've prepared for this, and it's a difficult situation. There's been no more positive cases this morning. I was updated this morning prior to coming in. It's a difficult situation. There's been no staff furloughed on the basis of it from today, and it's being managed well. I think the difficulty, of course, is for families that are in the rooms for that period of time where they're having to quarantine, and we find that obviously difficult for those families when they're having to quarantine. But they're being well supported, and we know that this was going to happen. In any hospital, we know that this is going to happen, and that there's going to be exposures. We'll absolutely keep reviewing the processes at the hospital in terms of infection control. It's part of the reason we introduced masking actually for younger children and asked them to do that at the Children's Hospital, because it's one of the reasons kids obviously can spread it when they're asymptomatic, they don't have symptoms. But the Children's Hospital is one of the earlier hospitals to introduce N95 fit-tested masks early, and quite a number of weeks ago now, around multiple areas in the hospital, and so that's been quite protective from the PPE for the staff members, and we've been reviewing that actively as well at the hospital. But I think it is difficult, obviously, for the cancer ward to be affected, and they're just an incredible team, and the parent and patient cohort there, like the families are incredibly well connected and really supporting each other through this. But it's rippled through all of that that whole community, because they're all the ones that aren't in there now. I've got friends who are several years out from treatment who are immediately connecting to me, letting me know even before it was hit the media. They knew about it even before I knew as a staff member.
Do you know if families are able to quarantine with patients inside the hospital, or are they having to be separate at home for the 14 days?
I'm not going to confirm the exact details. I know that there's some parents and children that are a parent and a child that are in rooms, but I won't go into the details because I'm not actually on site there for this week.
Professor Sutton, do you mind if I just ask you another question? Sorry. ATAGI have just come out this morning recommending a third dose of vaccine for immunocompromised people. They're saying it should happen between 2 to 6 months after the second dose. When will people be able to walk in and get their third dose at a state-run hub?
Oh, look, if it's hot off the press, I need to reflect on that. I haven't seen that advice, but obviously we've got no supply issues, so I expect that as soon as we can incorporate the IT changes that allow for the bookings, and make sure that there's appropriate training and understanding with the staff who are providing that, and understand that there'll be people coming for a booster dose. There'll be a relatively small cohort, but we want to support that decision as soon as possible, obviously.
And in New South Wales today, it was revealed that they've seen a new strain of Delta coming through in their cases. Are we seeing that in our cases here in Victoria?
Not that I'm aware of, and I take some caution in terms of how people describe a different strain. A lot of people think it's a variant of concern, or it's something that's behaving in a way that would cause anxiety. It may just be that they're identifying that there's another lineage. There's a bit of evolutionary variation in the virus that they're seeing. That means that they're identifying a different population with a slightly different virus, but it's not necessarily of concern. We haven't been told of anything in relation to that.
In terms of the AHPPC guidance regarding furloughing staff, is that already in place in Victoria, or is that going to be rolled out?
Furloughing the staff.
Healthcare staff, sorry.
We've got our own furloughing matrix. It's been largely aligned with HPPC, and that's in place already.
There's been a huge spike in 000 calls in the last few weeks. Some have been aiming to be answered in 90 seconds. They've gone unanswered for 13 minutes. Are you aware of this issue and what is being done to combat?
Yeah, I'm sorry, I'm the wrong person to speak to ambulance calls.
Okay.
Get the minister here tomorrow.
In terms of our roadmap and reopening, Brett, you said you were confident we'd get to 90%. Looks like it definitely here in Victoria. New South Wales have basically said, I think, very few, if any, restrictions, no limits on gatherings and things like that when they get to 90. Do you envision a similar situation here? Is 90 the point where we can finally say it's all but over?
I don't know that you can ever say it's all but over. I think we always need to review how things are progressing. There are countries that have gotten to above 90% that have still had challenges. So Singapore got to more than 90% of its eligible population, 2,500 cases a day. 98% of those cases have no symptoms or are mild, but that's still 50 cases with more significant symptoms. They've still got some pressures on their hospital system, but it's very different. So bigger numbers than we've got in Victoria on a daily basis, but not the stresses and strains on the health system. But we need to see exactly what our trajectory would be if we get to that figure. As I say, we should aim higher, and if we can see that that's driving cases down and those cases are sustainably low and our health system's managing, and we've not got a huge burden of illness because we've got thousands of cases, then I think that's exactly where we want to be, and it's exactly what I hope we can get to. But I wouldn't jump to assumptions about what it looks like. Everyone's been surprised by what's come up over months and months of this pandemic.
Do you have any updates on what kind of difference it's made shortening the Pfizer interval to 3 weeks? Are we going to hit 70% double dose before the 26th?
It's certainly looking ahead of the 26th, but exactly what day it'll fall still depends on what the weather's going to be like, people's ongoing motivation to step up. But we've got vaccine bookings in many local government areas that suggest that there's more than 95% of people who are wanting their first dose. So we can expect that the 70% double dose will just be one of those lines in the sand that will continue to progress beyond. I think it's a really good sign.
Are people rescheduling their second doses?
Yeah, they are.
Do you have any figures on how many might have done that?
I don't have figures, but we can try and chase that up.
And what's your bet on when we'll hit that 70%? 3-4 days early, 5?
No, I'm really not sure. Look, it does depend on weekend activity sometimes, and the weather affects it, and it becomes harder and harder in certain LGAs as you get to that higher level. But we've already got LGAs in Victoria that have gone above the 95% mark. So here's a shout out to the Borough of Queenscliff and Corangamite Shire for their first dose above 95%. Really, really good signs.
Where are we still lagging? Which LGAs would you say is of most concern to you?
Look, I think it's always a priority for us to push vaccination coverage in our hotspot areas. So Hume has stepped up, no question that they've got much higher vaccination coverage, and their first dose coverage is really pushed on. But they still need that interval for their second dose, and so they're not above. They'll be there very soon. They're still not above the 50% 2-dose mark. And then Casey in the southeast. So Again, a big push on first doses, but they're not at that level that is going to see transmission turn around yet.
Has the government watered down its mandatory vaccination directions? I understand Commonwealth employees and court staff are exempt from the mandate.
Oh yeah, that's not a watering down. That's specific advice, legal advice, and supported by the Solicitor General that there are constitutional and other legal protections for some of those groups that mean that a mandate was really not a recommendation for those groups.
And will that apply to MPs too? I mean, are those of state MPs in the parliament?
Yeah, I believe so.
So
again,
that won't apply?
legal impediments or legal recommendations that MPs can't be within those mandates. That's not to say that there aren't other mechanisms for MPs to be managed, but the Treasurer can speak to that.
So just to clarify, that is no longer, MPs are no longer part of the public health order?
No, MPs have not been part of the mandate for legal advice around that. But as I understand it, not required for MPs in Victoria as well.
Just to clarify on that, Rich, yes, there's a separation of powers issue here that goes to the courts and the Parliament, but nonetheless, we are working on mechanisms to make sure that every Member of Parliament complies with the same sort of requirements that the public is expected to comply with through the mandate arrangements. The way that'll be managed will be through decisions of the Parliament itself, and discussions are going on, but that's the government's express intention.
I asked the Premier this last Friday, 7 days ago, exactly when we were talking about the mandatory vaccination rules, whether it was legally allowed, and he said yes it was. So legal advice has changed in the last 7 days?
Well, I don't really like to talk too much about legal advice, but yes, it's become increasingly apparent that there are some limitations upon what can be done. We're increasingly confident, by the way, that there is high, if not universal, take-up of vaccination amongst most members of Parliament. But of course, we want to be absolutely assured that members of Parliament comply with the same obligations that the mandates themselves impart. And we'll be doing that through a mechanism where the Parliament has to be the master of its own destiny. So we're not making, we're not applying one rule for Victorians who are mandated to behave in a certain way, and then not applying the same sort of rigour and responsibility to members of Parliament. We expect that to occur, and it will occur.
Do you have legal advice then that suggests it's fair to stop a Member of Parliament being in there voting on behalf of their constituents because of their vaccination status?
The answer is, so far as the principle of the separation of powers is concerned, this is a matter that would ultimately reside with the Parliament itself. If you're asking me, is it fair? I think it's not only fair, it's a moral imperative that the thing that the state is asking of the community, members of Parliament apply to themselves and apply to their responsibilities as members of Parliament. Absolutely. There will not be exceptions for members of Parliament. There might be a different mechanism that is applied, but make no mistake, this government is serious about having not applying one rule for us and another rule for them. This is a community-based effort, and we will insist upon it. But I make the obvious point as well. If people are unvaccinated at the time of a pandemic, they run the risk not only of getting infected themselves, but putting others at risk of infection, whether it be their parliamentary colleagues, their employees, or indeed the community members with which they interact. And that is a responsibility I don't believe anybody should be shirking, and certainly the government and the Parliament of Victoria won't.
So just to be crystal clear, the draft laws that were sent around last night to upper house MPs said that they could be banned from the precinct if they didn't prove that they were vaccinated. But under the new legal advice, that would be null and void, wouldn't it? The advice given last night.
Well, the arrangements that are being put in place, that will be put in place, will have the same effect. It will be a different mechanism for members of Parliament.
I've got one more question on the vaccine mandate. Well, maybe it's probably for Brett, but employees are concerned that these deadlines haven't really been feasible. It's a massive task to create health registers, and lawyers are saying that it hasn't given much time for workers to prepare. So would you consider an extension at all, given that it was only 2 weeks it was announced to get that first dose in?
Look, it's been announced for a few days already. The intention was very clear, and the announcement was very clear about the dates. There is an additional week for those who can make a booking up to the 22nd. So I think that's ample time, and I think the numbers we're talking about are relatively small. If there's a genuine obstruction to getting vaccinated, I don't think there'll be an obstruction to getting a booking. There are thousands and thousands of bookings that can accommodate that cohort. So, there's no intention to change the date.
There's more
in short.
apprehension from workers or any pushback that
Yeah,
workers will have to manage, essentially?
Look, I think people have lots of questions, but we are 20 months into this pandemic. We are a year almost into having the vaccine available. We have encouraged for months and months and months people to have those conversations with the health professional. They will also have opportunities at all of our state-run centres and pop-ups to speak to a health professional, nurse, immuniser, GP or other practitioner, senior pharmacist, around all of the issues they might have with the vaccine. I'd encourage them to do that, and they don't have to do it at the state hubs. They can book in with their GP to have those conversations if they've got a trusted individual. But this is not a new issue, and the concerns around vaccines, it's legitimate for people to raise them, but they need to speak through them with their health practitioner to resolve whatever concerns they may have.
When do kids at schools have to start wearing masks again?
We are in the process of drafting that now, so not 100% settled.
The kids on site today don't have to.
No, correct.
And secondly, for the outdoor retail, when we hit 70%, how do you envisage that working? Are we expecting shops at Chadstone to pull everything out of the car park for the day?
Look, I think it's an opportunity for retail to occur outdoors. It will not be for everyone, but it is for each and every retailer to think about whether that's a feasible and reasonable option for them, and there should be no limits to imagination about how that might happen, and obviously we encourage it. It's going to be a significantly lower risk approach, and to the extent that we can see it happening, it'll be great, but I'm not the one to make a call for each and every one of those retailers about whether it's feasible or practical for them.
Looking forward to next month, will you allow crowds at the Melbourne Cup? And if so, how many people do you think we can fit in?
Yeah, look, crowds will happen in one form or another through next month. I think that's reasonable. Clearly we'll be at the 80% double dose mark in early November at some point. And when we think about all of the other things that are allowed at the 80% double dose mark, there is a cumulative gathering of people outdoors in homes, etc., that means that a gathering for a specific event of thousands of people is not much in a relative sense. So there will be some events that can happen with thousands of people, but to be determined, and it goes, as it always has, goes through a public health assessment panel to see exactly which events and at what level those will take place.
Just one more for the Treasurer.
For the Treasurer.
Treasurer, the federal government has extended the hotspot declaration for another week. What does that mean for emergency payments, given we'll still be in lockdown for another week and a half after that?
Well, it means that the Commonwealth will continue to make those emergency payments under the disaster relief scheme. I understand they're winding them back as we meet the double dose measures, but they'll continue to pay them. And the state, for its part, will make those payments for those businesses that are adversely affected due to any public health orders outside of those areas in Victoria. You might have realised that on occasion I do get a bit grumpy with the Commonwealth in terms of payments, but with regard to this, we understand they are winding those payments back. But until we reach those 70 and 80% double dose, while they're subject of a hotspot area, they would be entitled to those disaster relief payments.
So for that week and a half after the 14th, the businesses that don't qualify for state support but were qualifying only for the Commonwealth support, what support will they then have?
Well, as the Commonwealth winds back its payments, the state would expect that we will also review the payments that we're making. Otherwise, we'll get this inequity applying across the system. Quite frankly, I agree with the new new Premier of New South Wales, who has recently indicated that probably it's a valuable thing that those payments continue for some time, but we recognise that the Commonwealth's made a call. We're not happy about it, but that's what's happening, and as a consequence we will see those payments wind back. The state will, however, continue to look at those areas where there is an enduring and continuing need, and we'll make decisions as it becomes apparent as we open up and as we see where that need exists.
Check. 800 mil a week, is that still where we're at in terms of the hit to the state bottom line with these current lockdowns?
In net, yeah, I'd say.
Thanks. Can I just ask one more quickly on the Parliament vaccine mandate? The two Liberal Democrat MPs in the upper house, so they've been vaccinated but they're opposed to having to hand over their records. They say that it's a power grab from the government in the upper house, taking two people from the crossbench out. What would your response to that be?
Oh, look, people have to be sensible. I mean, this is not an ideological debate. And a mask is not a political statement, it's a public health imperative. Similarly, being able to get vaccinated and declare you're vaccinated for the well-being of the people that you work with is an act of respect more than an act of coercion. So I respect the Liberal Democrats have a different view and they have different priorities, but the virus doesn't differentiate between those concerns. They need to get vaccinated and they need to demonstrate to their colleagues that they've been vaccinated. That is an imperative because it might be an expression of their liberty, but it's also an existential threat to those that they interact with if they cannot demonstrate that they are vaccinated. So I'd urge them to just shed the ideology momentarily and think about the well-being of the people they interact with.
Why not give, for example, those who don't want to give over their record or don't want to comply with that rule, why not give them the option to still cast their vote while not physically attending Parliament and therefore not posing a risk to others?
There is a constitutional problem with that. We've looked at it and it's been quite difficult to move around it, but the Constitution talks about the members of Parliament present at a meeting, so it pretty much well makes it impossible, short of changing the Constitution, which is a little bit more of a substantial process. I think there's been some efforts to make provision for people to participate remotely in the Parliament, but the voting arrangements are somewhat curtailed by the constitutional forms. Okay. Thanks very much, folks.
Selling Gucci in the car park.
Like being back in Bali.
I've got a mate who works in the warehouse. Gave it to me cheap.
Thanks, Lou.
It's cold in here though.
Well, I was admiring the...
Thanks, Trav.
Your thumb's
She was about